Thank you, everybody, and thank you for coming to this session. And thank you for that very lovely introduction. It can be summarized in one simple statement. I work in mental health research. I know very little except mental health research, and I've been doing that for over 25 years in Singapore. So again, a very warm welcome to all of you to our session today on mental health, decision-making, and learning. We have three very well-known speakers in this particular field, coming from different aspects of public health as well as clinical practice, who will be talking about the intersection of mental health and climate change and largely heat changes globally. I'll just go straight into it in the, taking the time into consideration. And the first talk will be given by our speaker from Duke NUS, Associate Professor Renzo Ginto. Dr. Ginto works on diverse aspects of the climate and health space, such as climate-resilient health systems and nexus of climate change and mental health. Currently, he's a member of a lot of organizations and committees. I will try to go through some of them. He is a member of the National Panel of Technical Experts of the Philippine Climate Change Commission, World Health Organization's Technical Advisory Group on the Ethics of Climate and Health, and the Lancet Commission on Sustainable Healthcare. He also serves as chair of the Committee on Environmental Health and Ecology of the Philippine Medical Association and convener of Planetary Health Philippines. The title of his talk is Connecting Climate Minds, Protecting Mental Health in an Era of a Warming Planet. So over to you, Renzo.
Thank you very much. Good afternoon, everyone. And it's a pleasure to be here to present to you this project entitled Connecting Climate Minds. I hope that this conference is allowing us to connect with one another and to find synergies so that we can tackle this existential crisis that we're facing, as well as its health effects, not only the physical, but also the mental and emotional health impacts. And this project is actually an international project funded by the Wellcome Trust. It was implemented from 2023 to 2024. Here you will see the different institutions that became part of this international collaborative led by Imperial College London in partnership with the Red Cross, Red Crescent Climate Center, and also a dozen other organizations, both academic and civil society. And I had the privilege to actually lead the Eastern and Southeastern Asia hub for this project. And the goal for this project is to,
in terms of range of mic,
a global research action agenda for climate change and mental health. I'm sure you may be wondering, and I'm really glad that I have many colleagues who are in this room, right? You're wondering, you're intrigued, what is the connection between the health of the planet and the health of our brains and our hearts? And that really is what we tried to tackle, to address in this global initiative. Hopefully that this agenda will inform our future, both scholarship but also interventions, our policies and practices in order, again, to address the nexus of climate and mental health.
So what I'm looking forward to is
crisis and the mental health crisis, they're both deeply interconnected. And in the next several slides,
the challenges
share
particularly increasingly human
how
is understanding the tools that are being used in the region to solve these regional specific challenges are really important, really interesting, and they can form
an invisible
solutions that we're looking to develop in my home.
1 out of 4 people living in this planet do have a mental health condition, but we know mental health is only about the pathology. It's really about our complete well-being. And sometimes there are days down, okay. They say it's okay to be not okay. But I hope everybody is feeling okay now in this conference. But you will see that after the pandemic, when people are being surveyed, especially young people, they are saying that their top concern is really their mental health and well-being. And, as you can see here in the Lancet Psychiatry Commission, the global mega trends that we're facing, misinformation, social media, the political crisis, tensions that we're seeing across the world, and also climate change and global environmental change. All these trends are influencing how we think, how we feel, and how we cope, and how we survive. Meanwhile, on the other hand, we have the climate crisis, which I think we've already heard a lot about during this conference. And we know climate change is the most pressing of all the environmental crises that we're facing. We have a deadline. We need to meet the Paris deadline by 2030 to make sure that we do not breach the 1.5 degrees Celsius limit that was articulated in the Paris Agreement. But it's very important to remember that climate change is just one of the many global environmental threats that we're facing. And here, I'm not sure if you're familiar with the concept of the planetary boundaries. This was developed by the Stockholm Resilience Center. And in 2023, they reported that out of the 9 planetary boundaries that have been identified, 6 have already been breached, violated, transgressed. And climate change, the boundary for climate change is one of the 6. Only one out of the 6. You know, biodiversity loss is another. Plastic pollution is also another planetary boundary. And so when you have 6 out of 9 boundaries already being breached, you know, if you're an emergency doctor, right? 6 out of 9 in the criteria have been met. That should be a cause for alarm, right? And we should be feeling a sense of urgency. And definitely a lot of young people are feeling worried, afraid, anxious, and even hopeless about what is yet to come in this era of planetary emergency. So why does climate change matter if you care about mental health? We know that climate change is a risk multiplier. It actually will exacerbate a lot of the health issues that we are already familiar with. And some of them we already heard from the past several sessions. And that's only about heat. We know climate change also creates other forms of hazards and alterations in the environment, which ultimately will affect human health. Its causes also overlap with other causes of poor mental health. I already alluded to this a while ago. People are concerned about so many things, the economy, you know, politics, but all of these are connected with the climate crisis as well. And the consequences will undermine progress as well unless addressed. If all of us will feel depressed and hopeless, we lose our sense of agency, then we will be less empowered to actually act on the climate crisis. And so that one secret ingredient to climate action is that we all feel empowered and equipped to address the crisis. On the other hand, why does mental health matter if you care about climate change and energy transition? In the recent years, you may have noticed that the health community has been very active in the climate discourse. 2 years ago, COP28 was the first time in the history of the climate negotiations when health was dedicated an entire day. You know, it took 28 years for the UN to allocate one day to talk about health issues as they relate to climate. And of course, the health sector is going to continue that work. There's nothing that will stop us. And we are also seeing that health is a powerful lever for climate action, because politicians may be less interested in the impacts on the environment, for example, but when we talk about health and how their citizens are going to be affected by climate change, that definitely catches their attention. We also need psychological resilience for societal transformation and climate resilience. I already mentioned that. We have the opportunity to align climate actions with health, social care, and well-being policies. We've been discussing about the need to decarbonize and fight fossil fuel dependency and also to adapt to climate change. But we also know that we need to fix our broken health systems. And we need to also establish mental health care systems which are close to non-existent in many countries, especially in the developing world. And then, of course, people who study and work on climate change are also starting to feel burned out. I hope when we conduct a quick survey here that you are not yet at that level when you feel hopeless and you feel that all the efforts that we're doing are already futile and not creating any impact. So we need to cut the vicious cycle between the mental health crisis and the climate crisis. The climate emergency is also a mental health emergency, both directly and indirectly, which in turn limits the capacity of individuals, of communities, and systems to cope with and act on the climate crisis. So here, I'm showing to you more specifics, how climate change affects mental health. So first, climate change worsens mental health challenges and increases risk of new ones. So here are some statistics: 10% higher hospital attendance for psychiatric disorders during heat waves. And the symptoms reported by people who experience extreme weather events like heat waves also increase, for example, according to this report in Australia. Climate change also disrupts conditions needed for good mental health. So this is the more indirect pathway that links climate and mental health. Disrupting livelihoods, disrupting healthcare systems, disrupting cultural practices that, for example, indigenous populations feel deeply tied to, tied and connected to. And that can also affect their mental and emotional well-being. There's also distress due to climate awareness. Certainly, to be afraid of a crisis, of a threat, that's rational, but it can eventually become pathological later on. It can pose risks to mental health and well-being, especially with all the misinformation that is circulating on social media. And then, of course, the physical health impacts of climate change can also bring about mental health consequences. When you experience malnutrition, when you're infected, for example, by a climate-related outbreak, infectious disease outbreak, that also can lead to worry, to anxiety, depression, fear, so on and so forth. So all those pathways that I described are also summarized in this diagram, and you will see again that there are both direct effects. There's a typhoon, a community gets forcibly displaced from their community, from their locale, and therefore that creates a lot of mental health challenges and worry and frustration, post-traumatic stress, for example. And then on the other hand, there are more insidious, indirect, invisible effects. You may have heard of terms like climate anxiety or eco-anxiety. Many young people are now saying they're not optimistic about their future. They're even afraid to procreate, to create their own families. They're worried about their future livelihood. There's another concept called solastalgia. Imagine you're a fisher person living along the coastlines, and you're not anymore catching the same amount or volume of fish, or you're seeing your house being devoured by the ocean, as many fisher folks will describe it. And solastalgia is that feeling of grief when you lose something, especially your own habitat, your own land, your own property. So as mentioned a while ago, I'm from the Philippines, and here are just some emerging evidence from the country. There was actually, in 2021, a 10-country cross-sectional survey that was published. And out of the 10 countries that were surveyed, young people, it was found out that the Filipino young people are the most climate anxious in the world. Around 90% are at least moderately to at most extremely worried about their future. Because in the Philippines, climate change is not an issue for tomorrow, it's already happening, right? And we just graduated from several months of typhoons, right? The second half of the year is usually the typhoon season, and then now in a few months, we will be encountering a heat wave, which we already experienced last year. And then we know that mental health impacts, as I mentioned, interact with other crises. And so when we talk about climate and mental health, we cannot put it in a silo and ignore the other determinants of mental health, which are also connected to the drivers of climate change. At the end of the day, everything is interconnected. And then I mentioned climate change is a mental health risk multiplier, and it also exacerbates vulnerabilities for certain populations. I will not go into the details of this slide, but you will see all the categories of populations that will be bearing the brunt, that will be suffering the consequences more than the others because of their circumstances, their situation, etc. So why should we be concerned about mental health if we work in the climate community, in particular in the heat health community? You will see here around 537 billion USD per year by 2050 will be lost because of the additional mental health burden due to climate hazards, air pollution, and lack of green space. So there's already growing evidence that mental health is also going to affect communities, health systems, economies, and therefore, as we try to address climate change, we cannot ignore mental health as well. So a while ago, I showed to you a slide about the vicious cycle. But we can turn and flip the narrative and look at the potential for a virtuous cycle. Our state of mind also impacts the state of our world. And therefore, we address climate change, we're going to improve the mental health and well-being of people. But also, if we improve the mental health and well-being of people, then we have a better chance to achieve that, what we call a social tipping point, when people feel very empowered and very connected, and we are in solidarity to again tackle this pressing existential challenge. And so climate action and mental health certainly can align. There are a lot of win-wins. And again, we have this opportunity to improve our collective capacity to address the climate crisis. But unfortunately, this is the challenge. Climate and mental health research is historically missed. For example, there are many initiatives. It's good that, for example, the IPCC's most recent report already started including mental health. And hopefully in the future editions, there will be more evidence to be incorporated in the IPCC reports, among others, because the science is rapidly growing. And this is what Connecting Climate Minds attempted to do, to bring together all those colleagues, academics, nonprofit organizations, etc., working in this nascent space. In terms of climate and mental health policy, it's also becoming more and more visible, especially in the recent climate negotiations. You heard many ministers of health also allude to the impacts of climate change on mental health. You have the WHO COP28 declaration also explicitly mentioning that. So in terms of policy, there's a growing recognition, and therefore the scientific and practice community will need to respond to that political momentum, but also take advantage of this growing attention on the nexus. So this network, Connecting Climate Minds, address this need for a research agenda. We need a research agenda that will really improve our measurement of the mental health burden, including the costs of climate change in particular. We want to unpack the ways by which climate change impacts mental health, because these are not fully understood, the mechanisms and the pathways. We also want to assess and measure the benefits and risks of climate action. If we do climate mitigation, if we transition our energy systems, if we pursue nature-based solutions like reforestation, rewilding, mangrove conservation, what will be the mental health benefits? The evidence is still yet to be generated. And then, of course, we also need evidence on the mental health interventions, because there will be communities that are communities that are already affected by climate change, and their mental health is being affected, and we need to make sure that their needs are being addressed as well. There's also a need for an action agenda. Let's do the research, let's generate the evidence, but we need action because time is running out, and we have a deadline, as I've mentioned. But unfortunately, right now, and hopefully that's changing because of this initiative, the community is still disconnected, the climate folks and the mental health folks. It's only recently that they were brought together in the same room. There's also an unequal distribution of efforts, of research, of initiatives. Most of the scholarship at the moment is being produced, for example, in North America and Europe, but we are doing our best in order to build the body of evidence from the Asia Pacific. And then, of course, the siloing not only of disciplines, but also sectors and even funders, right? There's climate funding, there's mental health funding. How can we bring all these funding sources together to build projects that address this nexus? So in the next few slides, in the next few minutes, I'll just give you a glimpse of what we created through Connecting Climate Minds. close to 1,000 people from around the world contributed to the global research and action agenda. And what's amazing about the project is that we did it in a bottom-up approach. We actually started with the regions before we came up with a global agenda. We also consulted people with lived experiences of climate change and or mental health. So there are farmers, there are indigenous communities, there are young people who were part of the process from the get-go. And of course, we have different academic institutions, some of which I mentioned a while ago, that contributed to the process and the scientific activities. So if you're interested, you can visit our website. I'll show to you the link is there at the bottom. This is the Eastern and Southeastern Asia community, and you can see the cover of the research agenda for the region. And when you look at the research agenda, we've listed maybe around 100 research questions that we need to answer for the next 10 years. Certainly, some questions pertain to heat and mental health, but I just want to remind you, this agenda covers not only heat, but all other climate hazards. For example, for Eastern Southeastern Asia, some of the priority themes that we identified include addressing inequities in the climate and mental health nexus for vulnerable groups, incorporating faith traditions and indigenous knowledge into climate and mental health interventions. If you remember yesterday, Jason mentioned that one of the priorities of GIN is to build the body of evidence on cultural and indigenous practices in the region. So this is very much aligned with what GIN is thinking about. And then implementing community-oriented and strength-based approaches, strength-based, hope-based, not fear-based approaches to addressing the climate and mental health nexus. And of course, we want to build capacity of researchers and academic institutions, but this requires deep interdisciplinarity. We were just talking a while ago, and I'm from public health, but I had to work with climate scientists, but also with psychologists and psychiatrists and anthropologists and many others, because we need to look at this nexus at a more holistic level. And we need to advocate for the integration of climate and mental health into regional and national policies. So if you visit our website, you'll see around 30 recordings of lived experiences from around the world of climate change and mental health. All of them signed the informed consent, of course. We also have a collection of case studies of emerging innovations, policy innovations, research innovations, interventions that are at the early stage that try or attempt to address the nexus. This slide just shows to you the process that we took in order to develop the agenda. Again, 1,000 participants, close to around 30 consultations, a global convening, a scientific team, all the way to the report. This is the anatomy of the global agenda, and I'll just move to the next slide because this elaborates more on that previous slide. We identified some of the fundamental concerns in this new field. The terminology, right? Climate anxiety is not yet included in the, the book of psychiatric conditions, DSM. Right? DSM. Methods and metrics. How do we conduct, surveys, right? And how do we incorporate climate change into many of our psychological tests and instruments? And then on your right side, you will see the themes that actually emerge from the process. How climate change is impacted and who are the vulnerable groups, but what are the protective factors as well? What are the pathways and mechanisms from the biological to the environmental to the social? What mental health interventions we need in order to address the mental health impacts of climate change? And how do we make sure that climate action improves mental health, both from the adaptation but also from the mitigation perspective? So, in a way, to conclude, right, our vision for the climate and mental health field, we want to make sure that we're transdisciplinary, we are inclusive, non-extractive, and co-creative with the people that we want to serve. We want to build awareness across all actors. We want to make sure that evidence influences policy and practice. We need to address this list of challenges, as you can see, funding, lack of standardization, the usual problems that we see in research. So I would just like to end by showing to you the website. Visit our website and you will see all the outputs of this collective. And finally, on February 19, our institute, the Duke NUS Sing Health Global Health Institute, will be holding a climate change and mental health workshop. It's a day-long workshop where we will be unpacking and exploring more of these issues with colleagues from across Asia and beyond. Thank you very much.
Thank you so much for that extremely thought-provoking yet hopeful lecture. So I really love that part about it. And something to think about, the social tipping point. Really a wonderful way to think about how we can bring about change. The next speaker today is Dr. Eliza Chung. Dr. Chung specializes in disaster mental health and psychosocial support for her clinical practice, for her research, as well as her fieldwork. She currently serves as a clinical psychologist and service in charge of mental health and psychosocial support at the Hong Kong Red Cross. She also leads the setup of the International Federation of Red Cross and Red Crescent Society, Asia Pacific Mental Health and Psychosocial Support Collaborative. And what I loved about it was she supports the region in emergency response, in capacity building, knowledge exchange, and engaging in humanitarian diplomacy and resource mobilization. She holds a PhD in public health, and she also serves as an adjunct assistant professor at the School of Public Health and Primary Care at the Chinese University of Hong Kong. So really at the, at an intersectionality of climate and mental health, we couldn't have asked for a better speaker. The title of her talk is Climate Anxiety, Ecological Grief, and the Increasing Incidence of Mental Health Conditions. How are we prepared to respond to the climate-related mental health and psychosocial impact? Over to you, Eliza.
Thank you so much. Good afternoon, everyone. So I'm Lisa. I'm coming from the Red Cross movement. So today I'm going to share with you about the mental health and psychosocial support impact of heat, and also some of the initiatives and activities, programs conducted by the Red Cross, hopefully providing some potential solutions for this very emerging crisis. First of all, I'm coming from what we call the Asia Pacific Mental Health and Psychosocial Support Collaborative. It's set up by 3 parties within the Red Cross movement, because we are really big. We are the largest humanitarian network in the world. We have 191 national societies all over the world. And right now, this regional setup based in Hong Kong, covering the 38 national societies in Asia Pacific, responding to the mental health and psychosocial support needs affected in these countries. Particularly, we support them in terms of emergency response, capacity building, knowledge management, information sharing, as well as engaging in humanitarian diplomacy and resources mobilization. And to begin with, our session, Ruth is helping me to show you one video that we took when we are having one workshop at the regional conference. So in this video, you're going to hear from our youth representative from Samoa, from Maldives, from Bhutan, the countries who really are facing the impact of climate change, and how do these young people feel about all these issues. And we can also feel what we call the eco-emotions. Thank you.
Maldives is only responsible for 0.003% of pollution. And yet, we have to bear the brunt of all the pollution and the global warming we have been facing from the bigger countries.
Even if we try our best to replant, regrow, and whatnot, it's still going to come down to the Pacific being vulnerable to climate change because our islands are sinking, our people are being displaced. That you can say that
So these are the first-person account from our young people. When we talk about the mental health impact in climate change, especially those who affecting our young persons, I think this is a very good examples for us to learn from. But before we dive into how mental health and climate change are interacting with one another, I would like to show you this slide on the economic impact of mental health due to climate change. And it's not just due to climate change, but it's also relating to climate-related hazards, air pollution, and inadequate access to green space. So it has been estimated that like the societal cost of the mental health disorders due to all these situations amount to almost $47 billion annually in 2030. And the estimated cost will continue to grow exponentially to $537 billion in 2050. If we consider to compare them to the baseline situation, the environmental factors remain in 2020. So that's the scale that we are talking about. And a lot of time when we talk about how climate change relating to the mental health, or more specifically heat to mental health, we are talking about several different pathways. There are direct pathways that just now you already mentioned because of some extreme weather events, because of the exposure to the disasters, crisis, heat wave, bushfire, that could have direct mental health impact. That has been well researched in the areas of disaster mental health, emergency mental health and psychosocial support. But at the same time, there are also some cumulative effect. For example, the rising of sea level, rising of the temperature, as well as what they say more indirect, which means people witness the like the changes in our environment and how does that affecting us in anticipating the potential impacts. Of course, when we look into like the direct impact from the climate or increased heat, climate change definitely increases the likelihood of some extreme events which can damage the local environments and the communities for sure, and which could associate with stressors or traumas like the displacement, food insecurity, grief and losses that could increase the mental health burden and affect the well-being. And at the same time, because of this exposure, that could also relating to some situation when people's severity of the symptoms will meet the clinical criteria so that they would be diagnosed, for example, under the categories of PTSD, depression, anxiety, or substance abuse. It's interesting to know that the risk of mortality due to alcohol and substance misuse also increased significantly during episodes of heat wave. So think about that. So that's like people with pre-existing mental health situations also suffer more during extreme weather events, for example, heat waves. And all these situation, we know that is only will be just increasing, all these extreme weather events, and we can see like the impact to the population is immense. There are loads of research on that one, but I would want to particularly draw your attention to these two conditions. Suicide is the direct loss of human lives. We know that a lot of research have already shown that increased suicidal rates with increasing temperatures have been reported globally, both in low resource setting as well as high resource setting. And analysis have suggested there is approximately 1% increase in the suicide rate per each 1 degree Celsius temperature increase. Of course, it has to meet a lot of criteria. For example, when the temperature passes a threshold that is unique to that specific location. But this is alarming, isn't it? When the temperature keeps increasing, our suicide rate in the society also increase. Not only that, but we also know from research that air pollution, extreme weather events like wildfire, hurricane also contribute to the higher rates of suicides. And then, at the same time, people with pre-existing mental illnesses, they are also more vulnerable with the effects of the climate change in physical as well as the mental health. People with psychosis, dementia, substance abuse, they have 2 to 3 times higher risk of death during the heat waves than people who without. And also the high temperatures associated globally with increased risk of hospital admission, which also, not just including physical conditions, but also psychological conditions like bipolar disorder, schizophrenia, alcohol, substance misuse, dementia, and also self-harm. Wow, this is really bad, isn't it? I just want to give you like some examples. Of course, the literature, the scientific research has been, is still accumulating, but then these are some of the direct impact onto mental health conditions. Just now, we have also a little bit touching upon some of the new lexicons, we would say, like new terminologies that derived from this climate change and mental health interactions. What we call, they are what we are calling them, they are the eco-emotions that people are feeling at the same time. Just like at the video that we saw just now from the narratives of our young people, there are some of the indirect impacts, we can say, while we are observing all these changes in our environment. For example, for climate anxiety, as defined by the American Psychological Association back in 2017, this is the chronic fear of the environmental doom that we are all facing. Of course, it includes a lot of different types of reactions or symptoms, including sleep disturbance. I know that our next speaker is also going to talk a bit more on the sleep disturbance part. Research have already found eco-anxiety is not, this concept has been observed among children, adolescents, adults, and we found that like young people are being affected more particularly. And secondly, ecological grief. This is the grief relating to the anticipated or experienced ecological losses. For example, the loss of species, loss of the ecosystems, or the meaningful landscape to the people. We have found particularly there are strong ties with some certain communities. For example, the indigenous communities, farmer communities, and also climate scientists like some of us here. Solastalgia, we would say, is referring to the pain, the sadness that we lost some of the treasured landscape. That's especially like important to us. We have found that, like, for example, young people in Indonesia, they have been reporting this solastalgia impact among them. And also some of the indigenous group in Canada, in Australia, Papua New Guinea. So these are not myths, but actual reality that are affecting many of us. But it's important to know, despite we are having all these kind of new lexicons, it doesn't mean that we are going to include all of them into our clinical handbook of diagnosing people whether or not they have mental disorders. They are not mental disorders. They are just, they could be normal reactions towards the fact, which reflects how we process it cognitively and psychologically towards the changes happening externally in the environment. Of course, we know with appropriate support and like support and assistance to people, we can also help them to cope with all these external changes. It's important to know, of course, heat or climate change is a very important global challenge we are facing. And we also need to understand all these against the backdrop of the global mental health burden, which is another global challenges that the whole world is facing right now. I may not need to like dive into all these figures, but we know that mental health conditions like depression and anxiety, they are accounting for like a significant amount in terms of the global burden of disease. Depression is leading is the leading disability in the world. Whole world, particularly among our young people. And the global economy are suffering because people cannot work or people die early because of all these mental health issues. And also the large treatment gap, which means people who have the mental health issues and conditions, but who did not receive the treatment. It has been estimated in high resource setting, up to 50% of people who need mental health services do not get it. And the figures go all the way up to 90% in low resource setting. So this is the reality that we are facing. And we know that all this climate impact on mental health is particularly affecting young people. That's also coinciding to the fact that around 75% of all the mental health conditions happening through our lifespan will happen before the age of 24. And that is the, how we're seeing the like coupling effect of the two. But as a clinical psychologist by training, I do not end my presentation in a very like gloomy or pessimistic note. The good news is that evidence also shows us that by individual or collective action on climate, it can also have positive impact to our mental health and reduce some climate-related anxiety or distress by engaging in some meaning-focused coping, which can bring benefits to both mental health and also our planetary health. So this is the good news, so that we can do a bit more in that. Particularly when we look into the role of behavioral science, it's very important if we want the whole community to act together for some collective climate action. It should not come as a surprise, because we always know that if we want to change behavior, we need to change how people think and how people feel. Is a known fact, of course, because we have like commercials, advertisement industry in our community. We know that we can change how people think and feel so that we can change their behavior. So that's why we can actually look into the psychological barriers for people to engage in climate action, some drivers for climate perceptions, and also how they can feel more in control and have the agency to make changes and have some impact. Because if our messaging is too gloomy, that people believe that they have no control over it, no matter what they do, they can not reverse the trend or do anything to help our environment, they are going to give up. They will not do anything. So we need to strike a balance in terms of how we want to communicate with the community. So this is the reason why at the Red Cross we have been producing quite a lot of different guidelines, programs for people to act upon, so that they can put their worries, change them into motivation for action. For example, our global Center on Mental Health and Psychosocial Support has conducted some consultative research by interviewing our national societies and asking about what kind of climate actions and programs they have been doing. One of the examples of the National Society responding to the mental health impact of climate change is this called the Weather Together. It's a comprehensive education toolkit established by the British Red Cross to empower learners aged from 10 to 16 years old with essential skills and knowledge for them to understand and to navigate the impact of climate and also towards their own psychological well-being. Is also helping them to understanding different topics, for example, flooding, because that is relevant in the British context, heat waves, as well as eco-anxiety. So in some other situation, they may develop, for example, the American Red Cross together with our Global Disaster Preparedness Center. They also have developed this toolkit called the Teen Prep Kit Wellness and Resilient Activities. So including them, not just climate action, but also action for them to take care of themselves, self-care, and also how to mobilize the community to work together. Because we know that social support and also social connection is important both for our mental well-being as well as for activism. Of course, you can also put your worries into action. In countries, for example, like Bangladesh facing heat waves, the National Society and also the IFRC, we also have been responding in the front line. May it be allocating immediate funding and response action in times of heat waves, or in the Philippines, they are also setting up cooling stations with mental health and psychosocial support program being integrated. We have also have these child-friendly spaces, activities and programs in all those cooling stations. So in summary, I would say that we want to, of course, encourage everyone to know more in this area of work. We know that we still need more collective knowledge to enhance on the literature, the scientific evidence, so that it advises on our action. We will also want to integrate the mental health and psychosocial support considerations into the main climate policies and the national strategies. Don't forget to include people with pre-existing conditions, like mental health conditions and disabilities, into the contingency and the evacuation planning in times of any climate-related events. And also, for some of the disaster management folks here in the room, including that mental health and psychosocial angle into the disaster risk reduction strategy, and also the emergency preparedness risk assessment would be very much important. So I hope that by talking about two major challenges that is affecting all of us in the world right now, we are also being able to brainstorm the solutions that can help us to hitting two birds with one stone. Thank you very much.
Thank you, Eliza, and thank you so much for the shout out for people with mental health conditions. I think especially when you talked about disaster planning for them, I think that struck a chord. Thank you. Our final speaker for today is Assistant Professor Cyrus Ho. Dr. Cyrus Ho actually dual hats. He works both as a researcher at the National University of Singapore. He is also a very well-known psychiatrist who provides care to people all the way from adolescents to older adults. He has various research interests, but I think, again, an intersectionality of mental health, neuropsychiatry, mood disorders, I would say even new ways of diagnosing mental health conditions, and of course, climate change and mental health. He teaches both undergraduates as well as postgraduates at the National University of Singapore, and he's also the Assistant Dean, Student Life and Wellbeing. I thought that was very appropriate, Cyrus, at the National University School Graduate School. His talk is titled Climate in Mind, Navigating the Psychological Impact of a Changing Environment. Thank you, Cyrus, over to you.
All right, good afternoon, everyone. Thanks for being here. So before I start my presentation proper, I would like to thank the organizing committee, for giving me this opportunity, as well as other speakers, this opportunity to talk about the psychological impact of mental health. It's the psychological impact of climate change, yeah. So, and I think that this is a really timely conversation because we know, as we heard from the previous speakers, there is a global increase in mental health issues driven by a multitude of factors. At the same time, there's also escalating climate change. So it is important that we start, thinking, out of the box of how we can navigate around two major crises to bring forth positive change. And it's really heartening to see so many people in this room who are interested to know about these two topics, and also policymakers, researchers from diverse views coming together to address this problem and providing that platform for action and collaboration. So this is the overview of my presentation, and I understand that my previous speakers have already spoken quite a bit about some of the topics, but I will go further in depth into particularly the mental health disorders, as well as some of the psychological impact on some of the at-risk populations. So talking about climate change and its effects, how it affects mental health, risk factors and vulnerable groups, and then zooming into the mental health issues, and lastly, impact on psychiatric patients and some potential interventions to improve mental health. So as we all know, climate change refers to long-term shifts in temperature and weather patterns. It could be due to natural causes, but it could also be due to man-made activities. And it's these man-made activities that we really want to be able to control, because it's something that is within our control field of influence. And we know about the consequences of temperature rise, which is multifold, and 3.6 billion people actually lived in areas that's highly susceptible to climate change. And it has been postulated between 2030 and 2050 is going to cause approximately 250,000 additional deaths per year. And you can see how catastrophic it is. And this slide just gives a very broad overview about the effects of climate change, which is multifold. besides driving displacement, as mentioned earlier on, threatening food security, increasing the spread of illnesses, and of course, straining on mental health. But how does climate change actually affect mental health? So the mental health of individuals is really a combination of a multitude of factors, ranging from personal factors such as personality, life experiences, to social events, social experiences, to environmental factors, and also political factors. And all these are increasingly being influenced by climate change. So talking about personal traits or personality, certain personality traits such as resilience, adaptability, they may help to buffer against climate-related stresses, while certain characteristics such as heightened sensitivity, neuroticism, hysteria may actually increase susceptibility to stress, anxiety, and distress. On the other hand, talking about coping mechanisms, effective coping mechanisms such as, problem solving, trying to seek support from people around us, may help to buffer and mitigate some of these difficulties. But on the other hand, if you have poor adaptive coping skills, such as, turning to substances, turning to alcohol, or even just pure avoidance, this can actually escalate and further amplify the issues of mental health. And then talking about economic stability, I think, and access to resources, I think it's quite clear-cut. With climate change coming in, affecting habitats, affecting livelihood, financial difficulties, loss of job employment, housing, all this will become issues. And having access to support in terms of housing, finances, will actually be a very important factor in mitigating complexities and issues. And of course, environmental factors. Environmental factors, in this case, we can talk about the climate-related events that people go through, such as the heat waves, the floods, which once again affect the various climates and affecting places where people lived in. And just now we talk about indigenous populations, they may be very closely tied to the environment that they lived in, because of the sense of identity, the sense of purpose and place that they're in, and this can certainly influence the mental health. And not forgetting policies and systemic supports that we briefly mentioned in previous speakers' talk as well. Because having access to support system, having access where government is actually particularly focusing on helping people to become better, to mitigate all these stresses becomes important. Climate adaptability, changes and policies becomes important. So this slide provides an overview of the complex interaction between environmental and social economic factors in terms of shaping mental health. And just now, previous speaker did mention about mental health challenges sometimes may intensify as people become more aware about climate change, more aware of the impacts of climate change when they witness it firsthand. And we also talk about vulnerabilities, social inequalities. All this may actually amplify the effects of climate change and mental health issues. And certain groups of people, which I will talk about in the next few slides, are at particularly higher risk of developing mental health issues. And we talk about the effects of mental health, being direct, indirect, and also we have to look at whether it's an acute event or whether it's subacute or chronic exposure. And in terms of mental health behaviors, because ultimately mental health issues will manifest as behaviors, so it can either be internalizing, whereby the person starts focusing inwards onto the self, leading to a lot of ruminations, negative perceptions, negative cognitions, which can in turn lead to depression, anxiety, social withdrawal, and ultimately suicide. Externalizing behaviors could be anger, frustration, leading to aggression, defiance, and violence. So it is important to recognize that not everyone will develop a diagnosable mental health disorder. As mentioned earlier on by previous speakers, everyone will actually behave differently, react differently to challenges around us. And many of the symptoms of the traumatic event's immediate response actually are understandable, are actually normal reactions of people that will resolve over time, provided that the stressor, is alleviated, provided that things get better, and most people will fully recover. However, there are some people who may be at increased risk of developing some of these issues, mental health issues. And talking about risk factors, which is very important for us to recognize, will be the circumstances of the climate-related disaster. So as listed over here, the severity, the duration of the disaster, and of course, being a witness first-hand or second-hand actually plays a very major role in shaping the person's perception and coping abilities. How fast help is being obtained, and how fast and how effective this help is. And of course, perceived lethality, the dangerousness of the event itself. Individual factors, female gender has been found to be associated. Lower education, social economic status. People who are the extreme age groups, from the very young to the very old, those with medical comorbidities who are chronically unwell. Minority, certain ethnic status, the indigenous group, for instance. And of course, people with psychiatric history, be it personal psychiatric history or a family history of mental illness. And people, and of course, difficulties and challenges, be it in the family or in the political arena in terms of instability. And of course, inadequate social support. And geographically, whether is it in a remote area that's inaccessible to help, to information, people in conflict zones, people in water-stressed areas, and of course, not forgetting migration, when people have to start migrating from the natural habitat they used to be in. Of course, having said that, there are also factors that determines a person's resilience, right, to be able to cope with stresses. And this includes people with good coping mechanisms, people who possess self-efficacy, who are able to cope in the events of stresses, and of course, if there's good social support. And and I do want to highlight in this slide that physical symptoms that's being experienced during the climate change and the perceived dangerousness of the climate event actually have been found associated with heightened psychological stress. And this association has been seen in our team's previous study on the 2013 South Asian haze. So that's why it is important to educate people and also to be able to moderate some of their fears and anticipated anxiety. So talking about climate-related mental health issues acutely, people, when they face a particular stressor, they get anxious, which is very normal. And with time, sometimes it becomes acute stress reactions, whereby they start having a little bit of low mood, having a bit of anxiety, but it usually goes away fairly quickly. And sleep becomes a problem for a lot of people as they start ruminating, as they start worrying about what's going to happen next. And of course, the environment, if it's too hot, people also have difficulty sleeping, right? And then a decreased sense of self and self-identity may happen when the people get displaced from homes and communities. So that's the acute stage. But as the event continues, subacute and chronic changes will start happening. So uncertainty about the future, and sometimes existential issues about humans, about what's going to happen to the entire species, the planet. Psychological threat to human existence is something that is really very pertinent. And then, of course, we talk about eco-grief, eco-anxiety, even eco-paralysis, whereby people just feel helpless and unable to do anything at all. And it has been found that younger generations, are particularly living in wealthier countries, they are particularly impacted. And this slide just shows the relationship in the study between daily minimum temperature and then the rates of expressed sentiments. You can see that at extreme temperature, the positive sentiments actually decreased, while negative sentiments actually went up with extreme temperature changes. And the impact on sleep. So in this particular global study, which looked at more than 47,000 adults wearing sleep tracking devices, they found that those who stayed in warmer temperatures actually had poorer sleep. And this is consistent across different countries. So once again, implying that with increase in climate change, there is actually a decrease in sleep. And they found that the elderly, women, people living in lower income countries are impacted the most. And it is associated with the rise per degree of temperature rise in terms of the lack of sleep. And this brings once again another form of inequality. So certain countries facing climate change will actually have sleep that's being impacted more. And you know what sleep does to people. When people have a lack of sleep, their cognition gets affected, they get moody, they get frustrated, mental and physical health gets affected. And this brings in other types of inequalities and decrease in productivity. And then talking about stress disorders. So acute stress disorders, adjustment disorders, post-traumatic stress disorders, these are a spectrum of stress disorders, with the most severe one being post-traumatic stress disorders. And studies have found PTSD post-disaster actually range from 25 to 40%. So you can see that the percentage is not that low. And any form of trauma, any form of weather changes can actually cause that. And it's been found to be higher in women, older people, as well as those of lower social economic status and poorer social support, plus people with pre-existing mental health issues. And depression, which has been touched on earlier, but what I do want to highlight is that you can see that the percentage of people with depressive symptoms as a result of climate change is not that low, 25 to 33%, but when we are talking about depressive symptoms, they may reach clinical diagnosis. But we are also talking about subclinical depression, sub-threshold depressive symptoms. And this may potentially increase the percentage. And depression is a chronic condition. So when people become depressed, they may not end up with depression per se, but with time, depression will set in. And depression, once it occurs, it doesn't go away that easily. So you can see from the study that even 1 year later, after the event started, the percentage of people who are still depressed still remains fairly high, suggesting that depression is pervasive and long-lasting. And possible mechanisms, besides talking about the reaction to environmental change, but there may be also biological mechanisms that lead to people becoming depressed. So the HPA axis, dysregulation leading to excessive cortisol increase, may actually be one of the contributing factors. And not forgetting environmental pollutants, your nitrogen oxides, sulfur oxides, all this have been found to be associated with neurotransmitter dysfunction. And of course, heat exposure, subsequent increase in inflammation can also potentially cause depression and other mental illnesses, because psychiatric illnesses are chronic inflammatory disorders as well that shares very common pathomechanisms. And of course, poverty, food insecurities as well. And this slide just wants to highlight the systemic consequences of depression. And just now we talked about depression leading to economic issues, leading to productivity, health issues. But this slide encapsulates how it actually leads to increase in arteriosclerosis, hypertension, diabetes, strokes, and things like that, and affecting the immune system. And suicide, so rising temperature has been found associated with suicide, and in fact, several different countries have identified the degree change in temperature change leading to percentage increase in suicide rates. And this slide just shows the modified risk of suicide rates going up with temperature increase. And potential mechanisms, once again, could be the HPA axis, but not forgetting cognitive issues such as hopelessness, neuroticism, impulsivity, aggression can also be associated with changes in serotonin, which can lead to depression, leading to suicide. And some studies have also found air pollution itself, in terms of the pollutants, correlating with suicide, and hypoxia as well. Aggression. Studies have also found that when there's extreme temperature changes, people get agitated. Aggression cases, violence actually increases, and they even correlated with temperature increase, leading to 1.5 increased risk of homicides in South Africa, and this is after they removed confounding factors. And possible mechanisms could be related to serotonin pathways once again. And for this particular slide, I just want to highlight that for people with mental health issues that are higher risk of having climate-related sort of issues. And in this particular study, when they look at the prevalence of 26 chronic diseases among people who passed away in British Columbia in a heat event, they found that mental illnesses such as depression and schizophrenia actually rendered people the most vulnerable. And when there's climate changes, psychiatric patients get hospitalized more as compared to other times. I also want to quickly highlight on seasonal affective disorder because this is a fairly well-known condition and the prevalence is actually up to 3%. But with climate change, probably the percentage may even go higher. And seasonal affective disorder is a type of depression that's very closely related to climate change. So there's two types of it, one that happens in fall and winter, the other one that happens in spring and summer. But with climate change, it is postulated that summer seasonal affective disorder is going to happen even more readily. And with this subtype of seasonal affective disorder, people tend to get more irritable, more agitated, more suicidal. And you can see that all these issues are going to rise even higher. And lastly, I also want to talk that air pollution, which could be related to heat and other forms of climate change, can actually affect brain mechanisms, circuitry events, which can increase the risk of psychiatric illnesses. Lastly, to talk about interventions, I think previous speakers have talked about it, but I think we do recognize that it's not easy to solve all these problems, and we need the entire village, the entire community, and in fact the whole world to come in to help, using cross-disciplinary interventions. So community resilience, I think it was spoken in the previous speaker's talk as well, but having a common network of people coming together to share difficulties, resilience training, I think is really important, not just for climate change, but also because mental health issues are actually rising. And then having awareness and being prepared for climate change, being prepared for handling adversities and challenges in life. So besides having campaigns, but we should start even earlier, even in schools, during the curriculums, talking about climate change and how they can navigate and cope with some of the difficulties. And then, of course, having targeted interventions like trauma-informed care, counseling services, peer support groups that not just talk generally about these issues, but also with some focus about climate-related changes. And then mindfulness practices, nature-based interventions, although we don't really have that many forests here, but I do know of people going to do forest therapy, even from Singapore. And then policy advocacy support about mental health policies, having policies that's mental health focused and also climate change focused as well. And then providing support for migrants. Not forgetting research, innovation about various topics, particularly eco-anxiety, digital mental health tools. And lastly, we do know that it's a complex issue that can't be resolved immediately, but at least we're talking about it now. And mental health issues are rising. By recognizing all the problems that we have, hopefully all of us can come together to solve these problems one by one. With that, thank you for your time.
Thank you, Cyrus, for that talk. So I would like to invite all the speakers on the stage. There are seats here. And there are some very important questions which have been raised, but please do feel free to vote for the questions that you like or to ask more questions. And we will go through at least a couple of them, keeping the time in mind. Yeah. Thank you. I think some parts of some questions have been answered, but let's take the one which had the most number of votes. Sorry, it's very hard to read even before. Yeah, thank you. So I think I would start with this question. This was something, in fact, I was talking to Eliza just before the talk started, and we were talking about how when there is a disaster or there is tsunami, there was a tsunami the last time, how do you get people to change their focus and talk about long-term mental health needs rather than talk about the here and now, which could be, really making sure that people are safe drinking water, things like that. So the question is, So the question here is, while key to consider, how do we convince stakeholders to spend time to focus on mental health when other effects of heat or you can look at it as climate change, may be more immediate and pressing to address?
Sure. So maybe I can start first, but please chip in. It's very interesting. Whenever we talk about resilience, this terminology, we have been using it in a number of different sectors. But actually, this term is from the psychology study at the beginning, and it's talking about the ability for us to bounce back as an individual and also as a community. So when we are facing this climate crisis, it's also similar to when we are facing other types of disasters, emergencies, or conflict situation. We believe that building individuals' internal resilience, as well as building the community resilience before any crisis, would be the best way for us to cope with all the external changes. Of course, these are some of the concept theory, and in practice, in practical terms, just now some of the programs we have shared with all of you, for example, the Teen Kit, Teen Prep Kit, or the Weather Wellness Program, is all focusing on young people, school children, how they can understand the external environment and at the same time build the internal understanding of their own emotions, thoughts, and how do they process all this information, because they are really growing up in an era that is different from ours, because they always recall since their very young ages, whenever they read the newspaper or watch the televisions, everyone is threatening them about the environment. The sense of security and safety, this is important to all of our well-being. It could have different conditions for different age groups in our society. So that's why this really youth-focused program, I would say, is important for the community.
To add, so first and foremost, at least from our perspective in Connecting Climate Minds, we're not asking that we only focus on mental health and we forget about everything else. In fact, even if we're advocating for a greater attention to mental health, we're also the first ones to say we cannot forget about the material resources that are needed for good mental health, the physical infrastructure from the healthcare systems to, climate resilient housing, for example, because they are also important determinants of mental health. So it's not really an either-or question. We need to do everything, unfortunately, even and especially difficult, in a situation wherein we have limited resources. And I think what we are invited to do is to find ways to integrate mental health into what we're already doing, whether it's a program on agricultural resilience or disaster-proofing communities and infrastructure. And health systems. There's a lot of talk now about climate-resilient health systems or heat-proofing healthcare, because this is a heat health forum. Where is mental health in the equation? Of course, it's easier said than done, right? But it also asks us to think innovatively and creatively. It also asks us to engage more stakeholders because, for example, psychologists, psychiatrists, they're not your usual suspects in a conference on physical health, right, or climate and health. And then now we're realizing we cannot have good health overall without good mental health. And then we know, as I mentioned a while ago, it enhances our chance to really be united and to be empowered to address the climate crisis, because good mental resilience, mental health, mental resilience, not only of individuals but also of communities, collective resilience, is a critical ingredient for overall resilience building. And for the longest time, again, when we talk about disaster resilience, when we talk about resilience to slow onset events, oftentimes, if not all the time, we think of the architecture, we talk about the money, we talk about physical health needs. Mental health is not in the equation. But as I already also mentioned, it's changing. You're seeing more policies explicitly mentioning mental health. That's a good sign. We're now conducting a global review of national adaptation plans. Some NAPs of countries are actually pretty advanced and forward-looking and more progressive, recognizing that they cannot adapt as a country if they will ignore the mental health of their population.
Maybe I add one more bit. We have this, what we call in the area of mental health and psychosocial support, the hopeful principle. So we are talking about whenever we do any type of post-disaster or post-crisis interventions, there are 5 elements that are very important for everyone's recovery. They include calmness, safety, social connectedness, the sense of self-efficacy, community self-efficacy, which means we still have the ability to make changes, and lastly is hope. So all these 5 elements are very important, not just in mental health interventions, but in all interventions like water and sanitation, healthcare, infrastructure, like facilities. So whenever we are providing any types of interventions, we know that these 5 elements would help people to bounce back. So I think that would also be important to share.
Okay, so maybe just a very quick point, right? So we are talking about climate change, the environment, but who is inside this environment? It's actually humans, right? It's actually us. So okay, we do need to be very mindful, okay, of who our stakeholders are, who are the people, who are those who's going to be affected, and that's human beings, that's us. And if people have poor mental health, as I've shown in my slide earlier on, it will lead to poor physical health, right? Because they're all interconnected. And when people have poor mental and physical health, people won't care about climate change. People will not be able to do effectively to save the environment. So it's all interconnected.
It's paralyzing, right?
No worries. No. Yeah, I think, you know, when we think about a more psychosocial kind of overall factors associated with mental health rather than biological, it becomes very clear that all those other determinants, just by even improving them, we are in fact helping mental health. And as you said, it's not an either-or question at all. The second question, which actually even I have been thinking about for quite some time, is that the temperature has been rising over the years. And it is the same with awareness of mental health. So how confidently can we attribute some of the issues, that is some of the mental health changes that you have all talked about with climate change? Yeah. So Cyrus, if you want to start.
Okay, so definitely, right, mental health issues on the rise can be due to a lot of factors. Then climate change. So I think what the question is asking is that, so can we definitely contribute that the mental health issues is due to climate change and not due to other factors? I think this is not easy to tease out because, okay, even in research, we are... The subjects that we are doing research on, they are in that environment whereby there's climate change. But I think what's certain is that, right, based on quite a lot of studies, that people, when they try to do statistical analysis, they find that when they try to remove some of these factors, actually people's mental health is still being affected after removing some of those factors. And if you look from a biological perspective, right, actually common mechanisms actually comes into play. So things that leads to climate change actually, right, can actually through the same mechanism leads to depression, anxiety-related problems. So I do believe that there is this overlap that's there.
A few additional comments. Number one, this is not a unique issue for climate and mental health. It's in fact a challenge for the entire climate and health community. I was just talking yesterday with our colleague from the World Health Organization, and they recognize that they need to update that number. You may remember in 2014, there was a WHO report saying that from 2030 onwards, there will be 250,000 deaths annually due to climate change. And they recognize, even WHO, that that number needs to be updated because it only looked at 4 conditions, undernutrition, diarrheal disease, among others. Mental health is not part of it, and many others, right? So it's a question. It's actually a research question that we even identified in our process in connecting climate minds. But beyond the quantification, there is also a need to really dig deeper into the pathways and the mechanisms, because surely increased awareness of climate change and experience of climate change, whether it's direct or vicarious, you have family affected by climate change, it also affects you indirectly. Do we count that as an effect of climate change on mental health? The recognition of, or the awareness that climate action is very slow and very frustrating. We're frustrated about politicians. Do we count that as climate impact on mental health. So there are many questions still, which we identified, around mechanisms and pathways that we hope that the scientific community will pursue. And this requires a truly transdisciplinary approach as well. And then this question is important because, for example, many climate funders, Green Climate Fund and others, even private climate philanthropy, when they try to fund climate projects in general and climate and health projects in particular, they will say that we want to fund that part of the health burden that is attributable to climate change. Because, you know, for example, a country has many health problems, some of them not related to climate change. We cannot fund them all. We'll fund that section. So we really need to generate that evidence, both in numbers, but also in a more qualitative nature regarding the mechanisms and the pathways in order to even convince funders and decision makers to address that additional burden due to climate.
Yeah, relating to this question, I've shown you one study talking about the additional economic cost of mental health burden due to the climate status. In that study, actually the health economist is actually trying to tease out the impact. They classifying like disorders into different severity, and under which different severities will have different dollars assigned to it so that they can come up with the formula. But we all agree that it would be very difficult in practical context to tease out all these interacting impact and factors. I can quote an example. For example, back in 2004, when WHO was doing this prediction that by 2030, depression will become the #1 global disease burden, exceeding all other physical conditions. But then that formula would also need to be adjusted. For example, after COVID, we know that the mental health burden is getting so much worse, and how are we going to also factor in different like changing factors and put it into this formula? But that's definitely one area of further research.
I'm going to combine two questions into one. So I think it's a question of hope again, which is really about how do you, what exemplary interventions addressing climate change and mental health have you seen that could be scaled to different contexts? And very much in line with it, somebody else has also asked, I think they are talking about the same thing. They're talking about any successful mental health interventions at workplace. I think, again, thinking about the intersectionality. And if so, what were the benefits, and did it outweigh the cost of intervention?
So regarding mental health interventions to address the issue, the problems that we identified, we haven't really talked a lot of the three of us today, but there are also growing evidence and also practices all around the world. Is very interesting because traditionally when we deal with different kinds of mental disorders, for example, depression, anxiety, we talk about, for example, cognitive behavioral therapy. We change how people think, how people feel, and then the behavior would be different. But now we are also observing the fact that we may not be able to change the external facts. But what we are trying to do is to come into terms with it, try to accept it, process it, and so that internalizing it and adjusting to it. So that's why different types of interventions are now being used to address this kind of climate-related mental health conditions. For example, just now you also mentioned about mindfulness-based intervention, how we can be with the condition, be with the situation, and we are okay with that. We are not like being too overwhelmed by it so that we give up and we lose all the hope. So these could be like different types of interventions that right now in the I would say scientific or also the psychotherapy community are doing.
Just to add, usually the academic answer is, it's a research question, right? We need to find and develop and design and test more of these interventions. But I think it's important to be reminded that some of the interventions may already be existing, right? Forget about climate change for a second, and we already know what needs to be done to improve mental health. All the more we need to do them and to implement them and to scale them up and to democratize them in an era of a warming planet, right? So actually climate change in a way provides us with an additional reason to do what we need to do better and maybe bigger, right? Because the mental health crisis is deeply intertwined with the climate crisis. Having said that, there is also room for innovation, right? What are the new things, new tools that we need to think about, that we need to explore and test, you know? And you know, for example, you know, our colleagues from the UK, they have this, they were testing some, like, this intervention. It's a climate diary, young people, you know, writing about their thoughts, their experiences of climate change as a way for catharsis, but also as a way to, you know, reflect on the crisis and internally find ways to be, to contribute to the solution, right? I used to joke, because I'm from the Philippines, maybe karaoke is the intervention for us, right? But you know, Filipinos sing even in the face of disaster. But also, for example, in Zimbabwe, there's this approach that has been proven to be effective, the grandmother's bench, right? When grandmothers talk to the young people, and through that process, the young people are able to overcome their anxiety, their depression. Should we be doing more climate conversations amongst ourselves? And see whether, you know, not just greater awareness, but, you know, that the idea that, you know, we all care about each other because we're facing a common existential threat will actually make us feel a bit better and more empowered, right, to act on, you know, in a way, the problem.
I think for me, right, I feel that interventions that work are probably interventions that are integrated into a person's daily living. And I think some workplaces, you know, may really have implemented some of that. For instance, cutting down on the use of lifts, escalators, and then just taking more steps, walking. So this in itself some people may not think that it's climate change related, but actually it is, right? Because you're cutting down on electrical use, and at the same time you get to exercise, you get to walk a little bit more, like walking steps, so it improves in your physical and then actually your mental health. Because as you walk, sometimes you can walk together with your colleagues, you know, down, you know, and then you can chit-chat, you know, with that social support that comes in. So I think, right, as long as it integrates into a daily living, that doesn't become too intrusive, and yet at the same time allows social connectedness, I think that will actually be a very beneficial intervention. Yeah.
I have absolutely no idea how much time we have left, but I want to take one question more. Yeah, one more question. And I think it's an area which is close to, I think, many of us, which is, you know, the migrant workers in many countries who do not have the same ability as us to escape into air-conditioned rooms or, you know, to travel in air-conditioned vehicles, who are just outside in the sun. And so this question, I thought, was something that resounded very much with me. For outdoor workers with constant exposure to heat stress, are there practices or psychological tools to monitor the workers' mental health status, to reduce acute and chronic mental health problems, and also, you know, have there been any interventions in that area?
Right. So just now I also have shown one example. In the Philippines, when there are heat waves, the Philippine Red Cross have also been setting up some cooling centers out there for the community to go in, to relax a little bit, to just drink some cold water and with the AC and also fan on. At the same time, they are also including some mental health and psychosocial support program into it to talk about the importance of self-care, supporting one another, and also being able to like process how all these changes is affecting their lives and also the lives maybe in the family. So I guess this could be the way out, the approach that we can look at to integrate some of the environmental and also like physical structural mechanisms together with mental health and psychosocial programming be integrated into it. For example, in some Chinese saying, there has been like a saying talking about calming your mind actually can help cool your body. So that's also maybe one of the reasons why some mindfulness-based exercises or acceptance, commitment type of therapy is now being said to be the type of intervention we will be able to use to cope with conditions derived from climate change.
Yeah, I mean, I totally agree, because for example, migrant workers or some of the less more disadvantaged populations, they may not have the means to change the environment at that point in time. But the only way forward is to change how you feel about things and your perception. And it's just now as what mentioned, we don't want a state of learned helplessness. We want a state of resilience and maybe even anti-fragility, whereby you go beyond the circumstances to overcome it and become better. So the part about social connectedness, the part about trying to, within your means, develop support system, I think that is probably the way forward for some of the populations out there.
And lastly, of course, there's a tendency for us to technicalize the problem. Where is the intervention? What's the app that our consumers, that are intended beneficiaries can utilize? But ultimately, we need to address the working conditions, the housing conditions, their immigration status, and all these more upstream challenges and issues. Because if they feel integrated in society, if they feel that they have a community to rely on, whether you are a citizen or a non-citizen, you are actually able to access, for example, the mental health support that is available, for example, in Singapore, but also in any country. We live in a mobile world and a heating world, and we need to contend with these interacting challenges.
No, I just wanted to again end on a hopeful note to say that Ministry of Manpower in Singapore at least, and I think even in the rest of the world after the COVID, has taken a very different view of outdoor workers. There are many more programs, but I think one of the best things that I saw was the easiest thing to implement, which was about just the supervisor asking them how are they feeling and do they want to take a break, right? It's something as simple as that. So I think we can all do that, and we can all contribute more to dealing with the climate change as well as the mental health crisis all around us. This just leaves me to thank all the three speakers for amazing talks and for really a very thoughtful discussion, and to you, the audience, for coming today and supporting us, as well as your questions, which really added to a deeper understanding of this topic. Thank you so much.